Bowel surgery. What to expect when you're expecting a bowel resection. My endometriosis excision surgery involved a bowel resection. Here's what you need to know. I had no idea what it really meant to have a bowel resection. I knew that I had bowel endometriosis. A lesion or nodule was detected on several MRIs. Plus plenty of adhesions or scar tissue were identified between my bowel and the back of my uterus, cervix and vagina. My bowel was even adhered to my ovary with the endometrioma. Now I've posted quite a bit about bowel surgery. Because I was diagnosed with bowel endometriosis 9 years ago via laparoscopic surgery, and I've had almost every single symptom under the sun, which I share in this pinned post, I've done a lot of research and I've shared those learnings with you. So with the bowel lesion detected by the MRI, because on the MRI it measured less than 2 centimeters, I was told that in all likelihood it could be removed with a bowel shave. This involves cutting the endogrowth off the surface of the bowel without needing to cut into the bowel. Me being an optimist, I was like, it's going to be a bowel shave, it's going to be minimal surgery, don't even contemplate resection, you're all good. I was told that there's always a chance that I might need a bowel resection, by the way. It was made clear to me throughout that MRI isn't always accurate and that a surgeon will only know the reality once they're inside. The resection procedure was explained to me and I was told that at first I would be put on this liquid diet for about 24 hours and that thereafter I would ease back into normal eating. I also had a pre-surgery appointment with a stoma nurse who drew markers on my abdomen for where a possible stoma could be fitted. That's those blue marks you see just under the plasters. I can't tell you how fun that process was, but like I say, I put the prospect of bowel resection completely out of my mind. So when I woke up from surgery and the consultant came to see me to update me and he revealed that I had a bowel resection, I was in complete shock. I could not comprehend the news. Plus, I was majorly drugged up at that point. So what's a bowel resection like and what do I wish I knew sooner? So initially, straight out of surgery, in the critical ward, everything is being administered intravenously. I had 3 cannulas in my hands for pain relief, antibiotics, hydration and blood withdrawal. Nothing was administered orally. By the time I was discharged to the main ward, I'm still away with the fairies, but I start to feel as though I need to eat something. This is when I'm told I need to undergo a bowel reset protocol. Basically, the bowel is very sensitive and it doesn't like to be touched. So when it's had a whole section cut off, in my case 4 to 5 centimeters, best believe it's pissed. Patients need to tread carefully and follow strict instructions and monitor bowel activity. Doctors want to ensure that you consume food safely. Your bowel starts to slowly wake up, slowly work up again, gradually, so as not to compromise the resection. Compromising it can result in complications like bowel leaks. So to begin with, for the first 1 to 2 days post-op, I can only have liquids. I'm provided with a special menu with soft liquid foods. And I kid you not, there's one savory option. Consomme chicken soup. Basically strained chicken soup or chicken water as I like to call it. The only other options that appealed to me at the hospital were a fruit-flavoured yogurt and some jelly. So that's all I'm consuming for the first 1 to 2 days. It's unpleasant, but at the same time I'm very weak and nauseous after such a big surgery. I've had multiple organs treated and I'm on a cocktail of meds, mainly antibiotics and pain relief. Then there's the surgical trauma. Physically, it feels like someone's knifed at my abdomen multiple times. At the same time, I was experiencing these liquid and gas sensations moving around my organs. Gurgling about, I don't quite know how to describe it. It was like constantly. As unsettling as that was, I was told it was normal, that it's my body responding to major surgery. What the consultant was most concerned about was whether I was passing gas or anything resembling stools. Gas is the first hurdle. I was told repeatedly that it's a great sign because it signals that the bowel is working. I can report that it took me about 48 hours to fart. By day 3, I'm allowed to start eating solids. But there are rules. Meals have to be low fat and low fiber. This is because fiber and fat can be difficult to digest. They can cause gases, and you want to avoid the risk of blockages in the gut, as well as excessive gas production. It's also advised that 5 to 6 small meals are consumed as opposed to 3 full meals to avoid overloading and overwhelming the bowel. I was told to eat slowly and chew thoroughly. So at the hospital, I ordered the only appetizing thing on the menu. For me, that was poached chicken breast and boiled rice, which I would split into 2 halves, eating each portion about an hour or so apart. Nausea is still intense at this point, as is my abdominal discomfort. Fortunately, I managed to have a bowel movement on the first day of eating solids, and it was painful, but not where you'd presume, rectally. It was painful pelvically. To this day, 3 weeks on, I get that pelvic pain, alerting me that I need to pass gas or poop. But it goes away as soon as I relieve myself. Now let's talk laxatives. Laxatives are encouraged if you don't have any bowel activity. The fear is that your bowel becomes stunted and therefore leaves you constipated. This isn't ideal. For some reason, I was given a dose of laxatives despite having had some kind of a bowel movement. All I can say is never again. It sent my bowel into such a spasm. For hours, my entire back was throbbing in pain. I completely freaked out. I flipped out at the nurses because the whole time post bowel resection, you feel like you're walking on eggshells. You have all of these weird, new, uncomfortable and painful sensations that you can't explain, and you're worried they might resemble some kind of complication. And that was my greatest fear, to suffer a complication which might require further surgery, setting my recovery back. So to feel my bowel go completely haywire caused me so much distress, I panicked. I was told that the signs of complications typically are feeling unwell, high temperature and vomiting. And what's considered as a normal response to bowel surgery, aside from those I've already mentioned, is changes in bowel activity. Experiencing anything from urgency, diarrhea, incomplete bowel movements are apparently normal until your bowel settles. And settling can take 2 to 3 months. All I can say is thank God I made it through to the other side all okay. I was discharged with guidance from the nutritionist, which I will be sharing. On my next post on bowel resection surgery, I'll be delving into diet and the food reintroductory phase, as well as my tips on how to help heal your gut.